fat grafting.
Which I've never heard of.
Which is the best fat to use.
You're using your own body's tissues, and there's likely some advantages.
What if I gain weight? What if I lose weight?
But I'd say if you're going to gain 5-10 pounds, it's a non-issue.
How about the pigmentation? It seems like it went away too.
With fat grafting, that it has some secondary skin benefits.
Or else fat can be sort of relocated on the body.
Well, it's been used in cosmetic surgery, not just for facial rejuvenation.
I can be a donor.
Alina's in the cake business.
Oh, yeah,
She's a famous...
A lot of people listening to this podcast or watching are going to hear this and go, awesome.
Hi, everyone. It's Dr. Solomon. We're at UnPhiltered, our podcast, and today we are going to be talking about fat grafting and its uses in facial rejuvenation, especially in eyelid rejuvenation. And we've been lucky enough to bring in a patient who underwent the procedure. We're going to ask her some questions just to give you a flavor for what's involved with fat grafting.
All right. So many people are very familiar with filler treatments, and filler adds volume to creases and folds under the eyes and the tear troughs and the cheeks. Fat grafting can do the same, and it's just not as widely known treatment. It's been around actually for a long time. With technology, there's some advancements in recent years, probably the last decade. And now it's more commonly used, and especially in our clinic, we use it in the same treatments as well. Where you would do filler, we can do fat grafting. There's some pros and cons to each. And today we're going to talk about the pros of fat grafting. What is the benefit of fat grafting?
So fat grafting is an alternative to filler. It's a volumizer, but it also has some secondary benefits of just enhancing the skin quality. And so in many of the procedures that we're doing, surgical as well as energy devices such as laser, our goals are to reposition, enhance facial shape, but we're also trying to improve just the overall youthfulness of the skin. And for whatever reason, adding fat in seems to have a multifaceted approach to improving the quality of the skin. It's also great for filling in areas such as folds and hollows. So where do we use it? Most common areas that fat is used in our practice is around the eyes when we do blepharoplasty. If you look carefully at people that you may be friends with or family members, those that are developing the aging process around the eyes, most people over 40 will start seeing this. They're going to be starting to develop some changes in the skin under the eye. They're going to develop often a bag under the eye. And lastly, but just as importantly, they're developing a hollow under the eye known as a tear trough in this medial aspect. And there's also a lateral tear trough exposing the lateral orbital rim. And so if you just do a conventional eyelid operation, you may not be solving the whole problem. And so in the last decade or so, fat grafting has been really utilized more and more for anti-aging, especially to enhance surgical outcomes. In my opinion, a lot of the uses of fat grafting have overlapped with the uses of filler. So when filler first came out, it was used for, the folds only, and then it was used for the lips only. And then people started using it as a generalized volumizer, recognizing as you age that not only do you lose position of your face known as descent with gravity, but you also get deflationary effects. So for filling in the deflation, you can either use pre-made products known as hyaluronic acid, or there's a huge variety of different filler products on the market, but hyaluronic acid is the most common one. And that's often used to rejuvenate volume loss in the temples, tear troughs, cheeks, jawline, chin deflation. And as the evolution of where you could utilize fillers became broader, I think people such as myself and surgeons and cosmetic dermatologists who are doing fat grafting started realizing that you can use fat for similar roles. The difference between fat is you're using your own body's tissues, and there's likely some advantages related not only to collagen production, fat is longer acting, long lasting, and lastly, it seems as if there's some stem cell rejuvenative effects. And I have a colleague who trained me in head and neck oncology when I trained, who was using fat grafting to enhance surgical outcomes of patients who'd had surgery followed by radiation of the head and neck, where they had some damage to the skin from the radiation, and fat grafting was being used to volumize, but they felt that the skin actually started looking better and better. So it certainly has some benefits that we're not even fully aware of, and it's sort of still in evolution. So we use it frequently in facelifts. We use it frequent to enhance our results where we're filling in the folds, frequently the temple area, sometimes a little bit in the lips, frequently under the eyes. And we also use it commonly in blepharoplasty surgery. I'd say more than half of our blepharoplasties now, we're recommending it as an adjunct to the blepharoplasty. That's dealing with the bags under the eyes. So in our case that we're going to talk about today, in our guess that that's a patient that recently underwent the procedure, we can get more into why I thought it was a useful adjunct to her case.
I can assume that a lot of people listening to this podcast or watching are going to hear this and go, awesome, fat. I can get some fat removed. Where can I get it from? Can I get it taken from my stomach, or can I get it taken from my cheeks, or I have a little fat under my chin? Can we use that fat and put it here? So let's discuss where we can take fat from, which is the best fat to use. And then I've got a few more questions before we talk to our guests.
Yeah, so commonest donor sites, which you're asking about, is where do we take it from? The commonest donor sites is periumbilical, around the belly button area, which is an area most people have a little bit of extra abdominal fat. Love handles can be a great donor site. Medial and lateral thighs are great sites. Taking fat from facial areas like buccal fat and using it to inject elsewhere, we have done that. The quality of the fat is very different in the buccal fat than the body fat. That being said, it certainly can be a consideration. It has certain applications where it would be useful.
Can you take here from the chin?
There's not usually enough from under the chin. You theoretically could take fat any part of the body and use it for enhancing, but because fat's not a 1-to-1 ratio, when you're doing fat grafting, you're adding in quite a bit more than you would be with filler. So for instance, filler comes in tubes of roughly 1 cc, a teaspoon. When we're injecting fat, we're injecting much more than 1 cc. Most common amount of fat that we're injecting in the face would be around 20 to 25 cc's of fat. In eyelids, it's usually about 3 cc's per lower eyelid. So that's 6 cc's. When we harvest the fat, it comes with some fluid and some oils and other things that we put through a process where we try to get just the fat. And then with the fat, we sometimes process it into different size fat globules. And there's different systems available like that have little knives within them and filter systems to strain the fat through to make them thinner and thinner. There's something known as nanofat, which is almost like the cellular component of the fat has been broken down so much that it's almost like a rejuvenative type of fat skin treatment rather than an actual volumizer, depending on how thin you go. So a lot of this is still in the infancy stages of development. The application and use of it, we're well along the road. The understanding of exactly why it works, how it works, the benefits of it are still sort of evolving a little bit.
Okay, so a common question I'm sure lots of people are thinking, what if I gain weight? What if I lose weight? What happens to the fat that has now been transplanted into my face or injected into my face?
Yeah.
Do I gain weight there if I use my stomach fat and I put it in my cheeks?
We have seen patients that have noticed that if they put on a significant amount of weight, like if they put on like 50 pounds of weight or something like that. I've had the odd person come in who had fat grafting done years ago, and they say that their facial shape has changed and they feel that their fat that they had transposed has increased in size. It's sometimes hard to really know. I think the older fat grafting techniques, the fat was not put through the filters and things like that, so you'd have more common lumps and bumps and thicker fat balls that were sort of gave fat grafting a little bit of a bad name. Some of the concept of fat grafting evolved over, I think, the last 25 years. There's been a few notable surgeons that have spent a lot of time in their career sort of cultivating the uses of fat and have given us all sort of tricks in surgery to sort of avoid these complications. But I'd say if you're going to gain 5-10 pounds, it's a non-issue. If you're going to gain like 50 pounds, yeah, theoretically you could gain a little bit of weight in wherever the fat has been added.
Now, I've been around about 8 years, and I've seen lots of fat grafting cases. I have to say, I think it's the icing on the cake of your procedures, whether it's a facelift or a blepharoplasty. I think it only enhances the results, and the results always, in my eyes, look amazing. So I just want to say that because we're talking about the negative side about weight gain. So let's talk about where else fat can be sort of relocated on the body.
Well, it's been used in cosmetic surgery, not just for facial rejuvenation. I mean, my practice is exclusively facial surgery. So I've outlined some of the applications that we use it for, but fat grafting has been used by body plastic surgeons for decades. Commonest areas that have been used is mostly for butt augmentation. I think hip dip area, they've been doing fat augmentation. People have been adding fat in more recently into breast augmentation instead of implants as an alternative as well. It really depends on how much fat you have available. So the limitation on fat grafting is your donor site. So, if someone's like, we have the odd patient come in who's like a triathlete and they're like looking to do some fat grafting and they actually need volume. So you end up in a difficult situation where you need fat, they're hollow on their face because they've been working out like crazy there for like decades, and they've had facial wasting, and they're perfect candidate for fat grafting, but they don't have great donor site, and that becomes the tricky thing. And then we have to look for alternatives to fat in cases like that. I have had a couple patients who've convinced me to go ahead and try to harvest fat for fat grafting. We've obviously been clear about the limitations based on their body type. But more often than not, we're able to get a little bit of fat, especially from the lateral and medial thighs. So that's just a side note on it. But let's switch gears back to
Alina.
our guest today.
I can be a donor.
Well, that's just it. That's a good question.
Can I be on the donor list?
Do you have to use your own fat or can you use somebody else's fat? What if you are very lean, you're in great shape, but you don't have enough fat to put in your face? Can you use somebody else's fat?
Can I say one like side joke about you?
Yes.
Or no?
Yeah.
I don't know if it's related to you, but I was going to say Alina's in the cake business.
Oh, yeah,
She's a famous cake business. So she could be useful for making sure people are prepped for surgery.
Exactly.
By feeding
Just
them
come
lots
see
of,
me.
Lots
Come
of
see me.
Okay,
I'll
come
get
see
you in
Alina
shape.
first, and you'll get some good fat, and then you can come to us for the fat
Definitely.
grafting.
That's a plan.
Yeah,
That's a plan.
That's a plan. Yeah, that's.
Anyways, you can't use somebody else's fat and put it in your face, I'm assuming, right?
We've had a lot of patients ask that question. But anyway, so let's go over Alina's story, why we...
So Alina...
You tell us sort of why you were coming here as a patient, what you were looking to do, and how we were able to help you.
My goal was to remove my bags under my eyes because that runs in my family, and my dad has these huge ones that I just don't want to end up like him. I did a little bit of research, not a lot. I wanted a doctor that just did face. So I've never done anything, and I was a little bit, I don't know, apprehensive. And I saw Dr. Salomon's Instagram. I consulted I have a cousin who's a plastic surgeon in the States, and I said, look at the site, tell me what, how it looks, right? He says, why? For what I can see, the results are really good. So I trusted Dr. Salomon. I came here and I just said, can I get my bags removed? And he suggested fat grafting with that, which I've never heard of. When he explained, it made a lot of sense. I mean, if you're gonna take out the bags, he showed me also the hollow around my eyes, which I didn't know they existed, and he suggested that, and it was pretty, it made a lot of sense.
We actually have a picture here of Alina before, so I can show you. You can see sort of Dr. Solomon if you want to.
Yeah, so, looking at Alina's picture here, there's two sort of things going on. There's the fat, which is herniated from the lower eyelids. And as you age, I tell people it's like a hammock. I have sort of a hammock underneath it, which is holding 3 fat pads. There are sort of 3 distinct fat pads up close to your eyeball. And as you age, that descends and it almost elongates the lower lid. And then at the same time, you lose a little bit of the volume along the orbital rim. You sometimes see young people who have it as well. Like it doesn't have to be age-related. It can be genetic as well. But again, if you just were to take out the fat, which was the way I was taught to do eyelid surgery, and most surgeons were, conventional treatment of lower eyelids was removing fat, which did make it look way better because it would smooth out the contour, but you would leave the hollow. And then as patients went through the aging process, they would hollow more and more. And we see a ton of patients who have had blepharoplasty, but they frequently, you can tell, like over time, they become almost more and more hollow. So the results of the fat grafting are to sort of blend in what's known as the eyelid cheek junction. And if you look at a baby, there's almost what's called a single curve from the eyelash almost to the cheek. And as you go through the aging process, you get what's called a double bubble. You get the lower eyelid and then a cheek. And so the fat grafting, the goal is to sort of restore some of that, not a single bubble, but a little bit less of a distinct separation from the eyelid and the cheek. And that's what we've done with you. And I'm looking at your pictures now and I'm looking at you in person. And really, I think it was the right call. I think we made a good choice.
I have a question. How about the pigmentation? It seems like it went away too, because I don't see a lot of that.
The shadowing.
Yeah.
The darkness,
shadowing. Yeah, the dark circles, like I seems like they're not there anymore.
And I think that's one of those unknown factors we were talking about with fat grafting, that it has some secondary skin benefits that we're not even fully aware of why it happens. One is that it's creating space between the bone and the skin, so you're going to have less shadowing. But I think there actually is an improvement of skin color under the eyes as well, for whatever reason. Unlike filler, we have some patients who do eyelid surgery, or they've had eyelid surgery and they haven't had fat grafting, and they start to develop a hollow, and frequently they may get filler put in that area, which can look really good as well. The difference between the fat and the filler is that the filler often can, over time or even right away, have what's known as a Tyndall effect, where you get a little bit of a bluish hue and you can almost tell. So I can always tell if I'm just roaming around life and looking at people, if you see sort of a bluish hue under their eye, then frequently they've had some type of injectable filler. Whereas with fat grafting, the results generally are much less obvious, and they look more natural and don't have the telltale signs that anything's been done under there.
The only downside maybe we can discuss, which people talk about all the time, is the reabsorption. So you have to overcompensate for what you inject there because you're not really sure how the body's going to absorb some of the fat.
Right. Yeah. So there's an element of unpredictability, and it varies amongst patient to patient. We find that patients who are healthy, living a healthy lifestyle, not smoking, typically the fat grafting will survive because, you're transposing it from one part of the body to another. And then we're relying on the blood supply of the surrounding area for that fat to actually sort of take on the blood supply and stay living there. So usually there's a bit of a resorption. So we do overcorrect. Under the eyes, I'm very cautious not to overcorrect too much, because if it doesn't resorb, I don't want to give you like a big ridge there. So I'd rather have to do a second treatment if need be, if you were to develop a little bit of resorption. But I would say that's pretty uncommon. And the areas that we often overcorrect a little bit is the cheek area here, especially if someone's quite hollow. I know it's going to resorb a bit. And the temple area, areas that are a little bit more forgiving. But again, with the techniques that have, they're constantly evolving, I find that the resorption rate seems to be less and less if someone's got good donor fat. And we just never know who's going to have good donor fat. I mean, someone who's extremely thin, we're likely not going to get good donor fat. People who have just sort of healthy lifestyle, healthy living, a little bit of extra fat around their belly, which most people have, a little bit in their thighs, tend to do very well. And the resorption seems to be minimal, especially for eyelid rejuvenation versus full face rejuvenation. I tell people there's about a 50% chance, which is high, that you're going to potentially want to do a second treatment to enhance your result. That being said, it's not that it's not working. If we show them the before and afters, there'll be a significant improvement, but a lot of those patients may want a second treatment for full face rejuvenation. We've seen patients like that.
Well, you have to be careful.
They typically will do a second treatment because they liked it so much. So they see the benefits.
Or they do it in other areas of the face. Like Alina here is a one and done. She looks perfect now. She looks great. But there are some patients that see the benefits and what they accomplished under the eyes, and then they're in their 50s. Maybe they want to do a facelift, and then they're like, where else can I put this? Because it looks so good. And it really does. It really enhances your facelifts. I have to say that, because I think facelifts always look amazing. But the ones who do fat grafting with the facelift, I just think it's literally like the cherry on top. It just makes people just look so perfectly beautiful. But that's just my opinion.
No, I agree. I think adding fat in for a lot of these procedures is great. I think the decision whether to do it or not is often the patient's, not mine. If it was up to me, I'd probably use it as an extra tool for almost all our cases. But there's economic decisions, people's budgets, what they're willing to do. Some people, it's a big jump to doing surgery in the first place and want to sort of go slowly, and then maybe it sounds a bit overwhelming to say, hey, I know you came in for this, but I want to take belly fat. It may seem like a big jump. In this particular case, Alina was open-minded. I mean, you're not like some cosmetic surgery expert. You haven't had a ton done. You've been very lucky.
No.
You've been blessed genetically that you look good.
No, not at all. But I'm in my 50s, and some things start changing, and especially with my eyes, people always say, "Are you tired? Did you sleep okay?" And I'm like, "I'm perfect. I have energy." And then I would look in the mirror. I'm like, "Yeah, I look a little bit like tired," and that's not me. And now when I look in the mirror, I actually go, "Oh, yeah, that's my face
look good
again
today."
Yeah, I'm still surprised because it's only been a couple months, right? And
do people compliment you or notice?
Actually, they said, they said, "Oh, you look good. You look refreshed. You look like." They don't know. Well,
they don't know why.
Some people know because I went after a couple of days. I went back to work, and you have a little bit of bruising, but after I make sure everybody knew my husband wasn't beating me up because they were like, I said I had eye surgery. They didn't know to know exactly what, but in general, it's interesting because it's such a small change, but I think it really made my face more alive, right? And because I don't use a lot of makeup and all that, like I feel more comfortable. I don't feel like I have to hide it, which is worse because when I was trying to hide it, it was a different color, but it was like bulging as well, right? So I'm so happy. And like I said, I was apprehensive, but I felt very comfortable after my first consultation. And it was a very simple procedure, like the 2-in-1.
Great.
And definitely the right call. Yeah. So thank you.
Oh, you're welcome. And thanks for trusting me. And it was a pleasure working with you. And thanks for taking the time to do the podcast with us. It's super fun for us, but it's very helpful for patients looking for procedures just to calm their nerves and make sure that they, see other people and that it may empower people to do stuff that they're otherwise afraid to do.
I'm surprised how easy it was. Like, obviously you're all drugged after the first day you feel like you're not in this world, but there's no pain after. I was very surprised. No pain, a little bit of discomfort maybe. But
how many days at home did you need?
I spent 2 days because I found that second day I puffed up quite a bit. When the first day I didn't look so bad. The second day I'm like, wow. And then third and fourth I just went out. Yeah,
that's great.
Yeah,
good.
So it was good. Yeah. If anything, the belly was more bothersome than the eyes, right? But I think it was pretty easy. Yeah.
Good.
Yeah. Thank you.
You're very welcome. Yeah. Okay, guys. Well, thanks for joining us on another episode of Unfiltered. And hopefully this was informative and helped you learn and gain knowledge on facial aesthetic plastic surgery.